Well, there may be a new COVID vaccine for the smallest children starting this summer.
Today, Moderna said their low-dose vaccine works in babies, toddlers, and preschoolers. Right now, the youngest age group can get the shot is 5 years old with Pfizer's vaccine. Joined now by Dr. Stephen Turkovich, the Chief Medical Officer at Oshai Children's Hospital. Doctor, thank you so much again for joining us this afternoon.
My pleasure.
All right, so let's talk about this pretty big announcement, and one that I'm sure that you and your folks there at Oshai have been waiting for quite some time.
Yeah, this is really exciting. This is another tool in our toolkit as we fight COVID. As we know, children less than 5 years old have not been eligible for vaccine yet. Pfizer had submitted some data that we unfortunately was not as promising as we wanted a few months ago. So this is really encouraging to see the Moderna data. Basically, what it shows is that the children in this age group, 6 months to 5 years, had the same immune response to the vaccine that adults did. So that's the good news. Bad news is it responded to Omicron the way that adults did, in that it was only about 40% effective in reducing infection. However, it does seem to be very effective in reducing severe disease. So it's a mixed picture, but overall very positive.
So we know when compared to adults, COVID is typically less dangerous in children, but serious cases are still possible. Let me ask you, doctor, what are you seeing specifically when it comes to children 5 and under?
Yeah, so we, during the Omicron wave, did see a significant increase in the number of children admitted with COVID to Oshai Children's Hospital. Fortunately, we haven't had any deaths here from COVID, but if you look at the CDC data, there have been almost 400 children less than the age of 5 who have died from COVID. So as you said, it's not as severe traditionally in kids, but it can be severe. We also know that there are long-term side effects of COVID, even with mild disease. So children can go on to develop long COVID. We have seen children admitted with MIS-C, that multisystem inflammatory syndrome, which can be pretty severe. And sometimes those kids will have some long-term cardiac or heart defects associated with it.
So when Pfizer's was discussed or released earlier this year, or perhaps late last year, there was a bit of a delay in terms of getting it out, getting it into arms, getting it fully approved. Do you expect that kind of a delay with the feds for Moderna?
Well, appropriately so. I think there's going to be a lot of scrutiny on this data. Clearly the efficacy is not where we would like it in terms of preventing disease, but what they're going to be looking at the long-term severe disease prevention, which is really the most important. We know that as your immune system gets primed with these vaccines, you become better and better at recognizing the disease. So although you may not have enough antibodies initially to prevent infection, by each dose of the vaccine, and including potential boosters in the future, your body becomes better at preventing that severe disease. So that's going to be what they're looking at specifically. They're also looking, obviously, at the side effects. And the good news is the side effect profile for this is very similar to that in adults, and that it's fairly mild.
Now, when you talk about side effects, taking parents into consideration, a lot of them have questions, concerns. Then you have those parents who are waiting for this protection for children in this age range that didn't have that protection. What would you say to them?
Well, this side effect profile looks very similar to other childhood vaccines. About 17% of children 6 months to 2 years had fevers, and about 15% of 2 to 6-year-old had fevers with this vaccine. So it's very mild. There were no severe side effects. The one question that I know is on parents' mind is the myocarditis, or the inflammation of the heart. There were no cases of myocarditis reported during this study of almost 7,000 children. So that's very, very encouraging.
A lot of really good information there.
Yeah, without question. Dr. Stephen Turkovich, the Chief Medical Officer at Oshai Children's Hospital. Once again, thank you. Important information.
Thanks for having me.
And switching